and practice of counseling and psychotherapy. Chapter 14, Family Systems Therapy. The Family Systems Perspective. Individuals are best understood through assessing the interactions between family members. A family is an interactional unit. Actions by an individual will influence all family members. A systems orientation broadens the traditional emphasis on individual internal dynamics. Symptoms are viewed as an expression of a dysfunction within a family. Problematic behaviors serve a purpose for the family, are unintentionally maintained by family processes, function of the family's inability to operate productively, system of dysfunctional patterns handed down across generations. Development of Family Systems Therapy. Developed by Alfred Adler, adolescent-focused therapy is based on an educational model that emphasizes family atmosphere and family constellation. Therapists are collaborators who seek to join the family. Parent interviews yield hunches about the purposes underlying the children's misbehavior. Theoretical and clinical model developed by Murray Bowen that involved from psychoanalytic principles and practices. The family is viewed as an emotional unit. Unresolved emotional reactivity to one's family must be addressed if one hopes to achieve a mature and unique personality. Differentiation of the self, a psychological separation from others. Triangulation, a third party is recruited to reduce anxiety and stabilize a couple's relationship. Multigenerational family therapy treatment goals. To change the individuals within the context of the system. To end generation-to-generation transmission of problems by resolving emotional attachments. To lessen anxiety and relieve symptoms. To increase the individual member's level of differentiation. Structural Strategic Family Therapy. Created by Salvador Minuchin, this approach focuses on family interactions to understand the structure or organization of the family. Symptoms are a byproduct of structural failings. Structural changes must occur in a family before an individual's symptoms can be reduced. Reduce symptoms of dysfunction and bring about structural change by the following: modifying the family's transactional rules, bringing about structural change within the system by modifying rules, establishing appropriate boundaries. Strategic Family Therapy. J. Haley developed this approach, which is often used in combination with structural family therapy. J. and Minuchin shared similarities in goals and process. The interventions generated became synonymous with a systems approach. They included joining, boundary setting, unbalancing, reframing, ordeals, paradoxical intentions, and enactments. Treatment goals of strategic family therapy. Resolve presenting problems by focusing on behavioral sequences. Get people to behave differently. Shift the family organization so that the presenting problem is no longer functional. Move the family toward the appropriate stage of family development. Recent innovations of family therapy. In recent times, feminism, multiculturalism, and postmodern social constructionism have all entered the family therapy field. These models are more collaborative, treating clients, individuals, couples, or families as experts in their own lives. These models represent a real paradigm shift in the field of family therapy. A multi-layered process of family therapy. Families are multi-layered systems that often affect and are affected by the larger systems in which they are embedded. Both members and the system can be assessed based on power, alignment, organization, structure, development, culture, and gender. Forming a relationship. The debate Carl Rogers in 1980 first introduced individual therapy in the 1940s has reemerged within family therapy in the form of these questions. What expertise does the therapist have in relation to the family, and how should that expertise be used? How directive should therapists be in relation to families, and what does that say about the uses of power in therapy? Conducting an assessment. Therapists often use Genogram's method for conducting an assessment, which enables the family structure in a clear manner. Practitioners may use circular or relational questioning to get at the systemic issues presented in the family story that will provide meaning for the therapist and the family. Hypothesizing and sharing meaning. Following are two questions relevant to the form of hypothesizing one chooses to do. Number 1, how much faith do the therapist and the family have in the ideas they generate? Number 2, how much of an influence is the therapist willing to be in the lives of people and families? The therapist cannot be in charge of the people, but they need to be in charge of the process. Feminists and social constructionists are the most expressive of their concerns about the misuse of power in therapy. They're joined by multiculturalists, person-centered therapists, Adlerians, and existentialists who have also witnessed the often imposition of dominant culture in therapy. Dreikers, 1950-1997, developed the process that is well designed for this kind of collaborative work. He would use a passionate interest and curiosity to ask questions and gather together the subjective perspectives of family members. He would honor the ideas that individuals brought to their joint understanding. Facilitating change. Techniques are more important that see the therapist expert and in charge of making change happen. Planning include what family therapy is called techniques or interventions, but with the family's participation. Possible outcomes is only limited by the resources available internally and externally to the family. Strengths from a diversity perspective. Many ethnic and cultural groups place great value on the extended family. Monica McGoldrick has been the most influential leader in the development of gender and cultural perspectives and frameworks in family practice. The individual culture of the family, the larger cultures to which the family members belong, and host culture that dominates the family's life are explored. Shortcomings from a diversity perspective. The process of differentiation occurs in most cultures, but it takes on a different shape due to cultural norms. Some practitioners may erroneously assume Western models of family are universal. Some family therapists focus primarily on the nuclear family, which is based on Western notions. Contributions of family systems approaches. In most systemic approaches, neither the individual or the family is blamed for a particular dysfunction. Identifying and exploring internal, developmental, and purposeful interactional patterns empowers the family. An individual is not scapegoated as the bad person in the family. Limitations and criticisms of family systems approach. An overemphasis on the system may result in the unique characteristics and needs of individuals being overlooked. Practitioners must not assume that Western models of family are universal and must be culturally competent. Therapists are finding ways to broaden their views of individuation, appropriate gender roles, family life cycles, and extended families.